Thank you for sticking with us. I know it's been a long day, but the conversation has been robust, and I'm looking forward to this final discussion of approaches to current and future treatment for patients affected with type 2 and 3 SMA, and also the perspectives of caregivers of those individuals. We have a great panel lined up for you. We've got Rio, Angie, Kristin, Hugo, Gina, and Liza. So I'll go ahead and turn it over to Rio to start us off. Thank you.
All right. Thank you for allowing me to tell my story about my life with a child who has SMA. I'm Rio Landa, and my son Mateo is 8 years old and has SMA type 2. He was first diagnosed at 1 year old after a 6-month wait. He is a weak type 2, meaning he cannot crawl, walk, and has limited movement in his arms, very little in his legs, and he could only sit for 30 seconds if placed in the perfect position. He drives a powered wheelchair, which also stands him up like a transformer, and we are struggling to get him a manual wheelchair. Although most of our days are as normal as possible, a handful of days are spent on a roller coaster of breathing treatments, suction machines, or worrying about equipment. To be honest, there is a constant worry about what slight muscle function he is losing, whether it be harder to chew his lunch or harder to generate a cough if he becomes ill. Recently, some of this has been taken off my shoulders as my son was approved for Spinraza. My son's progress has been, up to about a year or two ago, on a surprisingly nice plateau. At the age of 18 months, he was put on valproic acid off-label, as it was shown to be neuroprotective in a subpopulation of children with SMA. Having little side effects that we could easily monitor for, it was worth a try for us. My son happened to be in the group that benefited from valproic acid, as most doctors expected his natural progression to be much worse. Valproic acid has enabled him to not decline so rapidly, so he is able to do things like stand in his stander, chew and eat orally, write, play Legos, and use his iPad. My son was excluded from the Spinraza clinical trial due to a genetic mutation causing long QT. It was a heartbreaking realization. Fortunately, he is currently receiving Spinraza and is able to stay on valproic acid. So far, we have seen subtle but important improvements in his physical abilities. Literally, 2 weeks ago, he reached for a few Legos on his shelf by turning his trunk and reaching out his arm, something he could not have done before. Before Spinraza, he would have had to drive as close as possible to the shelf, slide his arm along the table to get the Lego. He has also been able to chew about half of his meals without supporting his chin with his arm, and he can sit unsupported for over 2 minutes while holding a small object in front of him. Furthermore, we are hoping that with Spinraza, he will be able to generate a stronger cough, chew a little better, and have better fine motor control. We know it will not allow him to walk, but we just want him to be healthier for longer. Improvements such as improved fine motor strength, like the ability to hold a spoon or write, and lower extremity strength are not well addressed in current treatments. It is important to remember that SMA is a progressive disease. It's ugly over time. Even if the current treatment doesn't offer much in terms of strength gained, a slowing of the progression of SMA is extremely meaningful. But as parents, we're always hoping for another drug to come along that can improve our child's strength and improve the debilitating and devastating effects of SMA. It would be great if the future treatment would better address arm and leg strength. Contractures and scoliosis are central factors that affect the quality of life of a person with SMA. Many children and adults suffer from the comorbidities of contractures and scoliosis, such as a decreased ability to breathe and cough, the need for multiple spinal rod surgeries, the inability to use their hands and fingers as you or I would, and the inability to stand due to knee, ankle, and hip contractures. Meaningful improvements for a future drug could be as simple as slowing the progression of such comorbidities or improving the strength in one of those areas. Until December, there were no treatments for SMA. Unless you were able to take your child to one of a few doctors scattered across the US, be put on valproic acid or albuterol, the only thing you could do for your child was manage their symptoms and attend physical therapy. Every SMA parent I know has had to fight for something for their child, whether it be a new wheelchair, access at school, or to keep a needed breathing machine. Life is hard enough for those with SMA and those taking care of someone with SMA. As you can see, equipment is so important in the lives of these kids. Equipment from cough assist machines to suction machines to manual and power wheelchairs are all many kids have to stay healthy and access the world. It is very important that the latest equipment be brought through the government channels faster. There are so many options like lightweight wheelchairs and power chairs that our children do not have access to yet. As hopeful but realistic parents, we try to stay abreast with other medications in the pipeline to treat SMA. For me, it is exciting to see a number of new medications that show they can slow some part of this disease or even improve function. Luckily, with the current treatment, there are little side effects to worry about. In future treatments, I look for what benefit my child can gain from it versus any potential associated risks. Again, SMA can be an awful disease. When I look at the potential benefits versus risk factors, the risks have to be high not to consider the treatment or clinical trial if the drug shows it can help. Take the valproic acid my son takes. During the first 2 years he was put on it, we had to do routine about every 3-month blood test to make sure the medication wasn't affecting his liver or platelets. The benefit of valproic acid in slowing the course of his SMA versus the potential side effect was a risk I was willing to take. We are living an exciting time for SMA, but also a frustrating time. Speaking selfishly, my child is slowly getting older. Future treatments might look at therapies which can help regain better muscular function after it has been lost, or future treatments could address a different delivery for Spinraza, such as injection or oral compound that could improve extremity control. My statement to you would be thank you for expediting the approval of the current treatment, Spinraza. Every day that goes by, many people with SMA are slowly losing something they had yesterday. We are a realistic group of people. I know my child will never be able to walk, play soccer, or join the Army, although he really has no idea he can't. We want to see treatments that can slow this awful disease, or better yet, reverse some of the symptoms. Improvements as minute as slowing the progression of the disease to more visible improvements, such as increased fine motor control, better trunk control, or a stronger jaw for chewing. To you, my child being able to chew one more bite without his arm might seem meaningless, but in the picture of a healthy, happy life, it means the world. I ask that you continue to expedite future treatments for spinal muscular atrophy. After all, what would you do if this was your child?
Thank you for having me here today. My name is Angie Lee. I go by Angie. I'm 18 years old and I have SMA type 2. I was diagnosed with SMA when I was 15 months old, and since then I've used a variety of treatments to help ease life with SMA. Although I've had experience with more extravagant types of treatments, such as having a spinal fusion surgery when I was 10 to fix my scoliosis, or using cough assist machines and nebulizers when I'm sick, the use of those treatments is rare for me. The types of treatment I use most regularly take place in the form of physical therapy. However, the types and amount of therapy I receive have changed as I have grown older and the realities of my daily life have changed. Ever since I was little, I've gotten physical therapy. Since SMA is a progressive disease, working out or attempting to exercise by myself does not help me gain strength. Instead, it wears me out and makes my body more tired. Thus, physical therapy usually consists of the therapist stretching out my legs and arms for me in order to prevent my muscle tightness or range of motion from getting worse. Before entering middle school, going to physical therapy or going to aquatic therapy was almost like an extracurricular activity for me. I'd go for a couple hours every week, get stretched out, and it would be no big deal. As I grew older, however, life became more demanding, just as it does for everyone. In high school, I'm involved in choir, literary magazine, and student government. I barely have time to do this, keep up with my classes, have a social life, and get a reasonable amount of sleep. Fitting in time for therapy became more and more difficult. In this manner, I think one of the most difficult aspects of living with SMA is that the disease gets more demanding as life in general gets more demanding. For me, being a normal, active human being always takes precedent over being a patient of SMA. Especially since physical therapy does not necessarily improve the symptoms that affect my daily life. It just temporarily removes some tension and prevents my muscles from getting even tighter. Unfortunately, but inevitably, physical therapy has gotten lower on my list of priorities. Today, my parents or assistants at school stretch me for a total of about 20 minutes per day, but I only see my PT a couple times a year. I no longer have time for aquatic therapy, but I've recently started 40-minute massage therapy sessions about once or twice a month due to a noticeable increase in the tension in my neck and facial area. So I think another tricky thing about SMA is that there are so many layers to the symptoms. So to make an analogy, let's say you have the common cold. So your nose is running nonstop, so you have to blow your nose constantly, so your nose, the skin at the end of your nose gets damaged from rubbing it against the tissues so much. So as a treatment, you put Vaseline on the end of your nose to help the skin damage. Physical therapy and other therapeutic treatments for me are simply like putting Vaseline on your nose. It helps the outward results, but is not really doing anything to help the actual symptoms. Obviously, I want a cure for SMA, just as we'd want a cure for the common cold. But if we can't get a cure for the common cold, we'd at least want something to stop the runny nose. And for me, when it comes to SMA, the key things I would look for in a future treatment are the ability to maintain or improve my mobility and lung functions. However, perhaps this is because I'm blessed with the right people taking care of me that make life doable, or because I have SMA type 2, which isn't as severe as type 1, or because I've never been hospitalized due to pneumonia like some people here may have. But I personally am not in a hurry to get a treatment that will only have minimal effect or improvement. I think that many people tend to assume that my disease is my greatest obstacle and I would do anything to improve my condition, even in the slightest. But really, I'm just trying to pass Calculus 3 right now. But by no means am I saying that a treatment is not urgent. In fact, like I said before, SMA is progressive, and it's getting worse for me as I want to get more independent and active. I am saying that as an active individual, more than anything, whatever the treatment may be, what's most important to me is that it would be guaranteed to be extremely effective in helping the actual core symptoms of SMA, not just working on the surface level. I want something that would be worth interrupting, in a sense, my normal life. As a senior about to graduate from high school, I think I deserve to just be worried about picking out a prom dress, or passing Calc 3, or, I don't know, figuring out what I want to do with the rest of my life. I shouldn't have to worry about whether a treatment is worth my time and effort, or more than that, if it's worth getting my hopes up about. No one should have to worry about that. This is why I greatly hope for a cure for this disease, and why I find great hope in the treatments that are being developed now. Thank you.
My name is Kristin Farrell, and my 2 children have SMA. My son Braden is 5 years old and has SMA type 2, and my daughter Kernan is 4 and has SMA type 3. Braden is considered a strong type 2 and has been since diagnosis at 15 months of age. He is able to crawl independently for as long as he wants to, is able to walk using leg braces and a posterior walker, and uses a manual wheelchair with a power assist motor. Kernan is ambulatory, though she has many developing difficulties and requires assistance most of the time to mitigate falling and problems with her balance. Both children are healthy, happy, spirited, and determined, and take turns winning people over everywhere they go. We've been grateful that Braden has been part of the nusinersen clinical trial for the past 3 years. This opportunity has been life-changing for him and for us as a family, and we have seen measurable and valuable improvements in his function and movement since beginning the medication. One of the most impactful is his ability to give a tight hug and really squeeze on. Prior to beginning nusinersen, he was only able to limply drape his arms over your shoulders and could not grasp on. Presently, he can hold on around your neck and hang on, supporting his own body weight for over 30 seconds while you let go. Other improvements for him include increased muscle control, stamina, and fine motor strength. However, SMA symptoms do still appear. A progression in spinal curvature and scoliosis, hip issues, and fatigue are the latest as he grows older, taller, and heavier. In order to mitigate the symptoms of SMA, we do a variety of interventions. Keeping the kids healthy and retaining mobility and function are our priorities. Kernan and Braden participate in PT, OT, aquatic PT, equine-assisted therapy, and karate or ballet weekly. At home, we follow a regimen of vitamins, probiotics, and natural supplements, respiratory exercises like using the cough assist and nebulizer as needed, as well as perform regular stretching, range of motion exercises, using bracing for spine, legs, and feet, and use of equipment like wheelchairs, standers, and walkers several times per day. We consult quarterly with a medical team that consists of a pediatrician, 2 neurologists, a pulmonary team with respiratory therapists, orthopedist, nutritionist, and GI specialist. We also consult a specialty pediatric chiropractor regularly. Each of these have been long-standing interventions for us, and we have developed what is a carefully crafted schedule over the past 3 years. Everything we do at home and with our medical team, we feel is critical. It is difficult, though, to distinguish which has the highest benefit, but rather the overall benefit from the combination of interventions seems to be what is important. Clearly, these treatments are not all-inclusive, and we are always analyzing and researching to see what we should be adding, substituting, or removing from the repertoire. At best, these approaches limit disease progression and improve stamina while helping to maintain and possibly strengthen muscles, bones, and lungs. At worst, they are time-consuming and not always what a 5-year-old and a 4-year-old wants to be doing. And clearly these management of the almighty schedule becomes its own full-time job. Clearly, these aspects of disease management also do not address the natural progression of disease. They do not improve SMN production and do not provide motor neuron protection, nor do they guarantee any results beyond us doing the best we can with what we are able to do. It is frustrating for us sometimes as parents to be doing all therapy and yet not to have enough time to just be mom and dad. It's a constant race to fit it all in, to rush from appointment to appointment and attempt to not be consumed by the unwavering schedule. And of course, with 2 younger siblings, everything takes longer than it should. For us, an ideal treatment for SMA in the future would include best possible outcomes, improving SMN production, increasing neuroprotection, limiting or preventing muscle wasting, and allowing for functional improvements in strength. Everyday wins would be things like improved respiratory function, additionally of daily skills for life improvement, like being able to pull up the blanket to cover yourself in bed, to be able to more independently use the toilet, to put your own shoes on, and keep up with peers without excessive fatigue or physical limitation. As a family, we look to spend more quality time together, and being able to access things like outdoor activities are some of our priorities. When we analyze treatment options, common side effects are of little to no concern for us. Potential benefit would always outweigh those common side effects, and only more serious, life-threatening or life-altering and well-documented risks would be any kind of a deterrent. Our biggest fear as we face this disease is that of our children being unhappy, unable to be as independent as he and she wants to be, and that they have the very best possible quality of life. We're eternally grateful for all of the researchers, scientists, doctors, and regulators who are working to move treatments through the development process and hopefully get them to our kids and all people with SMA. We truly believe that our children are destined for great things. We thank you for your time and your partnership and for your continued interest in supporting the quest for treatment and ultimately a cure for SMA.
Hello, my name is Hugo Trevino. I am 27 years old and have spinal muscular atrophy type 3. I have a strong passion for helping others, and this has led me to work with the Muscular Dystrophy Association, where I am a resource specialist and get to work with newly diagnosed families and returning patients who are navigating their independence as adults for the first time. My current focus is with helping the Spanish-speaking community and creating outreach to make sure we help one of the most underserved and marginalized communities. I am currently also attending school full-time and obtaining my master's degree at the Loyola University Chicago in education with the focus in international higher education. Working for MDA has been a dream come true as I grew up with this organization, but recent breakthroughs in treatments have made it all more worthwhile. I have 3 other siblings. My oldest sister also has SMA type 3. Even with knowing what to expect, going through the diagnosis journey was not any easier for my parents. As my muscles weakened, I began to use my first walker at the age of 7 and received my first manual wheelchair when I was 9 years old. I completely stopped walking and acquired my first power wheelchair at the age of 12. By the time I was 15, I could no longer dress myself. My scoliosis, which had not seen much progression during my adolescent years, required me to undergo a spinal fusion as an adult at the age of 22. Overnight, I grew 3 inches and was able to breathe better as my rib cage was no longer crushing my lungs. Even though my disease has plateaued at the age of 25, I first started noticing muscle weakness and fatigue so severe that I could no longer feed myself on certain nights. Spinal muscular atrophy affects almost every aspect of my life. Accepting this disease and advocating for myself is what has made me love my life and live as independently as possible. Keeping up my strength and trying to stay on top of my health requires for me to do physical therapy at least once a week and as often as 5 times a week to stop any contractures and other muscle joint issues. I must use a cough assist once a day to keep my lungs cleared, and I am on 6 milligrams of albuterol sulfate to keep my breathing strong and to help decrease my fatigueness by the end of each day and week. Preventative care is always a must. Even when trying to eat healthy, my sedimentary lifestyle makes me gain weight. I try to limit my portions, but this means having to take vitamins and other supplements to make sure I get the proper nutrition. All the things I do to stay healthy lead to a better life and help me from getting sick while doing transfers. These so-called treatments have been slowly added to my daily routine and not all at once. Catching a cold or any virus can be life-threatening. Recently, I have had to begin taking steroids whenever I catch a pulmonary infection, as I am no longer strong enough to just cough up mucus and phlegm when I become sick. I am excited to see where medicine will go from here, as we now have Spinraza and other treatments in the pipeline. My current treatments do not stop my disease from progressing, but merely slow it down. I would be eternally grateful for a treatment that would be able to truly halt my disease and possibly even give me back strength. All of these home treatments are consuming and require me to have someone help me. Especially when it comes to physical therapy, I rely on total assist to complete this task, but it would be nice to be able to do these on my own. I have come to terms with not walking, but I would like to be able to do more activities on my own. At this point, I would be happy with the little things, such as gaining more independence and being able to dress myself, or not need care of a personal assistant to use the bathroom, or with transfers in and out of bed. Huge improvements would be not to feel so fatigued by the end of the day and not to struggle to feed myself. Not feeling so fatigued would also mean that I would not struggle to move my arms for the simple things like reaching for items or typing long papers as I'm in grad school. I hate feeling so fatigued on certain nights that I must stay in and not participate in everyday activities that allow me to live my life to the fullest. My current neurologist says my disease has plateaued, and I would agree with her, as I don't notice much change from year to year. Yet, as I look back or hang out with friends who haven't seen me in a while or years, they bring to light how I am not able to do things like I did before and require a little more assistance. They never say it in a negative way, but it definitely makes me reflect on how my disease is progressing, even though it's plateaued. It's not drastic, but it's still visible long term. Getting my independence back is worth some side effects if I am able to care for myself. I have accepted my disability, and if any treatment would shorten my life or cause me pain, then maybe I would not consider taking it. I rely on others for my independence, and it could be limiting at times, but not life-threatening, and I don't have any pain. Treatments like Spinraza give me more hope than ever. I never expected to see a cure or even a treatment during my lifetime. The best part of my job is when patients with other neuromuscular diseases call in and want to get involved with clinical trials as well. They never thought they would witness a treatment either and now want to become involved. More and more families with and without spinal muscular atrophy are curious about clinical trials, and these treatments are not just huge for the SMA community patients, but are also creating wonderful ripple effects of hope. Please help us continue to spread hope and independence that these patients need to live their lives to the fullest. Thank you for your time and your support as we join together for more treatments and hopefully one day a cure.
Hello, my name is Gina Kennedy. I am mom to 3 beautiful girls. My 2 youngest have SMA. Emma is 7 with type 3 and still walks independently. Ruby is 4 with type 2. She's 100% wheelchair dependent. Both of my daughters were fortunate enough to participate in the trial for Spinraza. Their lives have no doubt been dramatically altered by their trial participation. The drug has had a positive impact on their SMA, but they are still incredibly affected by their disease. Ruby's change in head control and arm strength from the past year on drug has given her independence and confidence that I never could have imagined. Still, she's dependent on others for much of her basic needs: toileting, transferring, dressing. While on drug, Ruby has fallen face first out of her wheelchair because it was not buckled. Her muscle reaction, response, and strength are still compromised. Emma, who's been on Spinraza for the past 4 years, has benefited by gaining large motor function. She can now climb steps, jump, kick a soccer ball, but every aspect of her day is still affected by SMA. Emma toes a very difficult line between typical and different. She lives in the space between able and not, and the effort in her life is hard to witness. She's nearing 8 years old, and things are changing for her. She can no longer get up from the floor without assistance. Her gait is labored even to those without trained eyes, and she tires easily after just a few minutes of active play. Most days, Emma needs help. She asks for help getting dressed, fixing her hair. She has a one-to-one aide at school and relies on a walker or scooter to navigate distance. Some days, writing is difficult. Her hand fatigues and the writing becomes illegible. Frequently by early evening, Emma is in tears and begs to be carried to her room. She asks for help wiping herself after toileting and cries at the thought of having to stand for 2 minutes to brush her teeth. The littlest of tasks are monumental. I am so thrilled that there is now an FDA-approved treatment for SMA. It is an incredible accomplishment, but it is only the first step, and we are far, far from done. The Spinraza approval addresses the need for something, but many symptoms of SMA remain, and we must work quickly to find ways to combat them. Our family is like most others who are battling this disease. We do every possible therapy we can, spending over 10 hours a week in physical, occupational, and aquatic therapies, and we will never relent. But my daughters need pharmacologic tools. We need drugs to treat the multiple symptoms of SMA. Thanks to Spinraza and our therapy regimen, Emma's muscles are more capable than they were when she was 4, but the strength is only available for small bursts of time. After 10 minutes of active play, she reaches muscle tolerance and excursion. SMA type 3 is a disease with great variability of strength. Last spring, Emma participated in her school field day. It was 2 hours of elementary gym games. She had so much fun and worked very hard to participate. But the following morning, she screamed out from her bed in fear. It was the first time she could not move her body. She was terrified. She stayed home from school for 2 days, resting and allowing her muscles to recoup. Emma often tells us that she feels betrayed by her muscles. She feels powerless in her body and openly struggles with the extreme fluctuations she has in motor abilities. Yesterday, she was able to walk to the kitchen for breakfast. She barely used her scooter, and she moved over 2,300 steps during her school day. But today, she came to breakfast seated in a manual wheelchair, and she could not even manage to gather her cereal bowl, her spoon, and the milk. She cannot depend on her body. She can't do extracurricular activities because there is no way to know if she'll have the stamina to attend the class. We need a way to recover muscle, stabilize strength, and afford prediction of ability for people living with SMA. Another symptom that remains is pain. Emma has hip, head, neck, leg, joint, and muscle pain. The only way we can currently alleviate the pain is through ice packs and ibuprofen and massage. This isn't good enough. People living with SMA cannot simply be destined for a life with excessive pain meds. I worry about the damage that will do to the rest of the systems. We need better tools to prevent joint pain and muscle soreness. We've also noticed that for both of our girls, SMA makes their metabolic function incredibly complex. There's very little known about this area of life with SMA. For our daughters, we observe significant changes within just a few hours of eating. We need to find ways to stop the catabolic state that SMA seems to create. Adding to the list of needs is cardio protection. Humans need 30 minutes of elevated heart rate at least 3 times a week, and people with SMA cannot meet this goal. SMA forces a sedentary lifestyle. How can we protect the cardiac function of people living with SMA? Future therapies need to address this concern. I know without a doubt that without Spinraza, Emma would not be taking steps, and Ruby would not be able to play in the yard so effortlessly in her power chair with such great head control. I am so thankful for where we've gotten. And we live in this world with SMA. So that means we live with an incredible amount of restriction, adaptation, devastation, and hope. So let's use what we know. Let's use what we've accomplished, but let's keep our sleeves rolled up and keep pressing on. We need more answers, we need more solutions, and we must never give up. Thank you.
Hi, I am Liza Wiseman. I'm 14 years old and a freshman at Skyline High School in Longmont, Colorado. My whole life, I've been in a wheelchair, although not until the summer before my 8th grade year did it really occur to me that being in a wheelchair was actually different. I grew up in the small town of Crestview, Colorado, and there I did basically everything that any other kid my age did. I enjoyed camping with my family in the summer, and I still love to ski every winter. My parents have always pushed me to the limit. Because of this, I am not the type of person that likes to depend on others, although I do. I love to get out in my community, in nature, and surprisingly, do schoolwork. These things are currently getting harder for me since I have been getting weaker. Throughout my whole life, I've constantly been doing different treatments to help with this. I currently take albuterol, a drug that has been proven to help increase strength. Also, I do physical therapy once a week, along with pool therapy. Recently, my main goal in therapy is to make sure my contractures in my hips don't get any worse and to try and prevent myself from getting any weaker. I am so grateful that just before my 2nd birthday, my parents chose to put me in the first ever drug trial for SMA. They had to make the difficult decision between valproic acid or sodium phenylbutyrate, PBA. PBA was a raw orphan drug that had been approved for urea cycle disorders and showed real promise in the lab. From the time I was 23 months old till last July, I took PBA. This drug has helped me immensely when it comes to gaining and keeping my strength. For example, when I was diagnosed at 13 months old, I was considered to be a weak type 2 and was unable to move independently. After taking PBA, I was able to use a walker and a stander. Also, I could crawl a little bit on hands and knees. Sodium phenylbutyrate is what has allowed me to stay as strong as I am today, although over the years, it has lost its effectiveness. Today, in addition to taking albuterol and doing therapy 2 days a week, I have had 12 back surgeries. 3 years of Veptirods that allowed me to grow resulted in the spinal fusion from T3 to pelvis. I've also chosen to live a paleo lifestyle in order to help regulate my weight. By not eating sugar, wheat, most grains, and most dairy, I have felt much better and have noticeably more energy. The best intervention yet is my dearest darling service puppy, Jewel. I love her so much. Not only does she pick things off the ground for me and open and close doors, but most importantly, she helps me get along with my peers, be present in my surroundings, and simply deal with everything life throws at me. As for other treatments, currently I use a BiPAP machine every night to keep my lungs strong, and the cough assist once a day to keep me from getting sick. While these treatments may keep me healthy and out of the hospital, they are not helping to stop the progression of my disease. Every single time I attempt to eat a bowl of soup or reach across my canvas while painting a picture, I know I am getting weaker. This really scares me as I want to continue to do the things I love, and I won't be able to if I lose much more strength. This year, I got my scuba diving certification and was able to play Frisbee with my sister for the first time while underwater. Scuba diving gives me the freedom to move and allows me to be weightless, not to mention see a bunch of really awesome things. With all the treatments I've done, I'm very fortunate as presently all of them have not had major side effects, besides simple nuisances like being time-consuming, and they're not always convenient. When it comes to new treatments for SMA, the ideal thing for me, other than a cure, would be for it to stop the progression of my disease and, if possible, let me gain some strength back. Another thing that I would like to see in terms of new treatments is something that would better help regulate my pain without having to constantly take pain medications. Every day I am in pain, and recently it is getting worse. It would be absolutely amazing to go through a day without being in pain. Overall, I'm curious and afraid of what the future has to offer me. I love my life. I love that my disease has taught me so many new things, and helped me gain most of my values. My hope is that however my treatments change in the future, and that whatever new treatments become available, I will still be able to live my life to the fullest, along with every other person with SMA, type 1, type 2, or type 3.
Thank you to all of our wonderful panelists. Now we're going to move into our polling for panel 4, which is on the current and future treatment approaches for those affected with SMA types 2 and 3. If we can get our polling slides up. All right. So our first question is, have you or your loved one ever been prescribed either by your doctor or through a clinical trial and taken the following medications? Please select all that apply. Give you a few more seconds to get your responses in. All right. So it looks like overwhelmingly inhaled albuterol has been the most prescribed and used medication. After that, it looks like we have quite a few different things that have been used. Those that appear not to be used much are albuterol tablets, hydroxyurea, riluzole has not been used at all. And it looks like sodium phenylbutyrate has only been used by a few, and a few of you have used other medications that have been prescribed to you. If we can move on to our next polling question. So this question is, what are you currently doing to help treat your or your loved one's SMA or SMA symptoms? And again, please select all that apply. So it looks like the most used approach to treat you and your loved one's symptoms is mobility equipment. After that, it looks like respiratory maintenance, physical therapy, and orthotic support. We also have a number of you using nutritional support, aquatherapy, occupational therapy, as well as orthopedic support. A few people using Spinraza and speech therapy. Nobody on other investigation or on any investigational products, and a few people using something else not on this list. We have our next polling question. So this question is, which of these do you or your loved one use for respiratory assistance? And again, please select all that apply. few more seconds to get your responses into this question. So it looks like the most common approach for respiratory assistance is the cough assist device, followed by non-invasive ventilation, chest physiotherapy for clearance and comfort, suction to remove secretions. Then a little bit fewer of you use high-frequency chest wall oscillation vests, postural drainage. A few of you use other, and maybe only one or two of you, or a small portion of you, use invasive ventilation or a mechanical ventilator. Can we get our next polling question? This question is, have you or your loved one undergone scoliosis surgery, such as growing rods or spinal fusion? Yes or no? All right. It looks like a little over half of our respondents have not undergone scoliosis surgery, and a little under half of you have. All right. Can we move on to our next question? So this question is, which outcome would you rank as most important for a possible drug treatment? Since these are a little long, I will read those. For A, it's the treatment will provide gains in function. B is the treatment will lessen symptoms that would improve quality of life. C is the treatment would stop or slow down disease progression. D is the treatment would prolong the lifespan. And E is other. So choose your most important possible drug treatment effect. All right. A few more seconds to get your responses in. And it looks like about two-thirds, a little under two-thirds of you would want to see gains in function, increases in strength, energy, or doing things that you were unable to do before. About a quarter of you would like to see a stop or slow in the disease progression. About a little under 10% would like to have a lessen in symptoms that would improve quality of life. And 2% would like to see improvement in lifespan. And can we get is there any more? One more question. So this question is, which of the following factors would influence your decision to not use or stop a given treatment? And please select all that apply. All right, a few more seconds here on this last polling question before we move to audience discussion. All right, so overwhelmingly, the factor you would consider that would influence your decision to not use or stop a given treatment would be significant risks of serious side effects. After that, but much lower at about much lower is the cost of the treatment. And then each of the other factors are a number of you mentioned. And then a few of you also said other. So let's explore some of these questions a little bit more for those of you affected with type 2 and 3 SMA and your caregivers. So the first question goes to build upon what our panels have discussed a little bit in the morning, but much more so in the afternoon, and what we were trying to address with some of the polling questions. But really, have you had any different strategies than those that were used by the panel, or any variations in strategies to how you've approached your treatment? And this, again, can include drug therapies, it can include different devices that you've used, physical therapy or other types of therapy, as well as assistance for mobility, or just other lifestyle modifications. So we want to make sure we capture the full range of anything that you're doing to help manage your disease. And when you raise your hand, if you can wait for the mic and the camera to come to you. And again, also, please state your name and who you're representing.
My daughter is type 2, 17, and she was getting an IV infusion of permidronate for bone strengthening, and we now currently do an IV infusion of zoledronic acid to help with bone strengthening. She's had 4 stress fractures, or 3 stress fractures and 1 post-op complication fracture. But we're doing that to try to help keep her bones strong.
Right. And have you noticed benefits from using these products, or?
Yeah, other than the post-op fracture, she hasn't had a fracture in a couple of years. So we're hoping they are making them a little stronger. And we've had to put off the standard because of surgery, so.
Okay. Thank you very much. Other different approaches to treatment? Yes, we'll start on this side of the table and we'll work our way around. Don't be camera shy.
Hi, my name is Kim Heinrich. My daughter is type 3. And in addition to some of the therapies that were already mentioned by the panel, who also have type 3 children, my daughter uses Ultraflex splints, knee and ankle orthotic type device to help manage the contractures of the knee and the ankle, which at one point in her life were severe enough that they were going to stop her mobility. We've been using them probably for 4 years now. But we had reached a point where the contracture was so significant that she was soon to stop ambulating. So that has worked very effectively, and we continue to support them and encourage others when they are asking about how to manage them. They have worked very well for us, and my daughter tolerates them very well, and she is old enough now as a 9-year-old that she knows the difference if I'm not there, as I'm not there today. And tonight and last night that she asked for them to be put on to make sure that she doesn't miss a night.
Sure.
But that's just one, we do several of the other aquatic therapy to improve stamina and endurance. The water therapy has been also extremely significant.
Great. Thank you very much. We'll work our way over to the other side of the table right here.
I'm Megan Ramirez. My daughter Madison is type 3. We started using Cough Assist right after Maddie was diagnosed, and after a few times of going, and I guess a year later after she started walking, they said that her lung function was high enough that she didn't have to use it every night, but we continued anyway. We had recommendations to use Cough Assist nightly even if she wasn't sick, just so that she wasn't afraid of the Cough Assist for when she was sick. And we just got into a routine of doing it, where eventually her lung function was over 100%, and they kept telling us that she's doing well and you don't have to keep doing it. She also did aquatherapy, and we had our own pool where she swam basically daily, and we contributed all of that to her lung function being so fabulous. And within the last year, when we had to sell our home with the pool, and we actually lost a lot of nursing care, and we weren't doing her Cough Assist nightly, her lung function decreased to about 70%. So even though we still do it, it wasn't as often, and so we have increased it back to every night in hopes that her lung function will increase again. The other thing that we did when she was younger, when she was not walking yet, my husband built we call them Maddie bars, but they're basically little parallel bars. And he was influenced by the Olympics that year when he watched the Olympics and decided to build these bars. And we feel like she learned to walk through the Maddie bars, and she would just start by standing on them. Eventually she was kind of walking back and forth with the parallel bars, and then she was sitting on them thinking she was doing tricks and things like that. But we contributed that to her progression to walk, and we're considering getting those back out now that she's lost her ability to walk, and possibly just being able to stand and bear weight through those and increase the size of them, obviously.
Oh, thank you. Very creative. While you're thinking about this, think if there's any, even of the things that were discussed, various approaches to treatment that maybe you or your loved one tried, and either for good reasons or bad have no longer used that approach to treatment, and can tell us why that is. So not just interested in what you're currently doing, but things that you've tried in the past, and can share your experience of how that's changed over time. Okay. Nope, right here in the center of the room.
So we were encouraged in the beginning because one of our concerns was the scoliosis with our daughter. So we were encouraged by Dr. Crawford to look into the TLSO brace, and at an early age start with that. Most parents wait till, from what he told us, they wait till the scoliosis sets in and then they put the brace on. Well, she didn't have scoliosis at the time, so we started with the brace fairly early. Now we don't really have anything to compare it to, but she's 4 now. We haven't had any of the lung failure or anything like that. Her scoliosis, you can tell it's still setting in, but it's not as severe as what we expected it to be or what we've heard in the past. So that was something that we were encouraged to do, and we feel it was a big help to us and to our daughter.
That's great. Thank you. Other unique approaches to treatment or progression and approaches?
So I'm going to kind of speak for both of us from Louisiana a little bit. My daughter's 3, strong type 2. Since she was diagnosed at a year, we've seen a geneticist based out of New Orleans who specializes in metabolic disorders. You mentioned metabolic issues. And he prescribes us a myriad of prescription meds and supplements to treat like the cell metabolism, energy metabolism, mitochondria dysfunction, anything from the typical levocarnitine, which she was deficient in. We didn't notice a strength increase in that. He prescribed something called cytotine, which is like a medical food grade creatine. The 2 things that we've seen the biggest change in her in is N-acetylcysteine, which caused a rapid improvement in endurance and strength right when we started it. And then ubiquinol, which is an activated form of CoQ10. And he he does lab work twice a year to kind of adjust her levels on all of that. And I believe Krista here, her children are on, if not the same, very similar supplements. And he actually has peer-reviewed, published journals about it in multiple disorders, but includes SMA in that paper.
Great. Thank you. I guess we're interested in, we have one comment over here, and then we'll come to that side. But yes, that's exactly the kinds of things we're interested in, the whole gamut. So.
So my sister and I did a lot of the normal physical therapy and occupational therapy in school growing up, standing frames. We used to have braces, the normal things like that. And they helped to an extent, but as we got older, we found less benefit for the cost and the effort to put into it. But I do think that one thing that contributed to a healthy respiratory system, or as healthy as you can be, I grew up and I sang and I played the flute, and I think that just those recreational activities really contributed to my ability to have good breath support. So I think just finding an activity that is enjoyable and also helpful physically is very beneficial.
Thank you. Now we'll shift to the far side. I believe there was a comment over there. Yes.
Hi, I'm Fiorena. My daughter's Mia. She's 7.5 years old, type 2. Super happy. I want to share with you guys something that actually, the more I think about it, it really was a life change. Mia was having severe sleep apnea, along with literally every 2 weeks, congestion that would turn into a cold, that would turn into hospital visits, and we couldn't quite figure it out. After seeing the ENT, he recommended shaving of the adenoids and tonsils. I'm not a fan of surgery. I'm not a fan of anything that's not, natural. So I didn't want to do it. It took me about maybe 8 months of SMA support and Googling and asking everybody in the world, what do I do? Long story short, we ended up doing it, Joe DiMaggio. The best decision we ever made, huge life changer. I want to share it because anyone maybe between the ages of 2 to 10 years old has sleep apnea and they can't quite figure out how to help the child. We didn't have to use BiPAP. Since we did the surgery last April, I think Mia's been sick maybe 2 times, whereas she was sick literally every month. So that was a big life change for us. So I hope it helps someone who might be going through sleep apnea, constant congestion, constant colds. Positive. Shaving, not removing.
Shaving.
Yeah, I don't know. Yes. I think to me that's a big difference. So
no.
Hope it helps.
Yes, thank you very much for sharing. Do we have any more comments on this topic? Yes. You can just use your
mic.
One
thing that I did too was I wanted to get my heart to get a little bit better because my sister, who also has SMA type 3, was experiencing like tachycardia. And even with me as well, like I started monitoring my heart rate through like my iPhone and stuff. And my heart was like hundreds, like 90s, like upper 90s. And so I bought this electric, like just little bike that weighs like maybe like 20, 15 pounds. And it's controlled with the remote. And so like I don't actually need to have the strength to pedal because I don't have the strength to pedal. But I could turn it on with like a button and increase like the strength that I have it go. And I would use it on my legs, and it did help. Like afterwards, like at the beginning, my feet felt really tingly from doing it since I live a pretty sedimentary lifestyle. But after a while, the tingly sensation started going away in my legs. I would use it in my arms as well. And then after a year of using it, my doctor, when I went back in, I was seeing a cardiologist as well. As I keep adding doctors, you end up having like an army of doctors. But she noticed that my heart rate went down to like the 80s and like high 70s. And so as like one of the other mothers here who was talking about how like you need that like elevated heart rate, that was something that like really helped me too, with not always having like tachycardia or like always feeling like my heart was pounding like out of my chest sometimes. And then it also allowed, because my doctor saw like the lower heart rates, she was able to prescribe me then all the albuterol sulfate on tablet forms to also be able to like breathe better and not feel so fatigued like at night. And so that was also part of like her monitoring my heart rate of like, and I would always send her the reports like at the end of each month so that she can kind of see that as well. And it really helped. But also at the beginning when I started taking the albuterol sulfate tablet, I would feel like as if I had drank like, I don't know, like a couple cups of coffee and like was super jittery. But that like went away after about like the first maybe month and a half. And I actually really enjoy it. And then if I forget to take it or if I go on a trip and forget my pills, I'm fine for like a day or two. But after the 3rd day, then I start declining and I do notice like more fatigueness. So that's helped with me too. But I know it's something that's not always trusted by every doctor. So it's something that you have to have a conversation to have.
Yeah, no, thank you. Thank you for sharing that. Any other experiences with current therapies? If not, we can switch the conversation to start talking about future therapy. So the overarching question is, short of a cure, what issues or symptoms would you like a potential treatment to address and why? I think one of the areas we'd really like to hone in on is, we've talked a lot of the experiences that we've heard from all of you this morning and on our panels. is that often in type 2 or type 3 SMA, there's a plateau, or it's just such a slow progression that maybe you yourself don't even notice the progression that occurs from year to year. And so you might have made the decision yourself to not seek a treatment that would interrupt or disrupt your life. And so my question for those of you that are kind of in that boat, what benefit would push you kind of over the edge to seek treatment and interrupt your life despite maybe not having that immediate or urgent need for therapy? So I guess we'll start back here.
My daughter is Madison. She's 10 years old and type 2. And I just wanted to share with everyone real quick. Ironically, during this meeting, I just got the call that my daughter was approved for the Spinraza treatment, and we will receive our first dose next week. So I want to thank everyone in this room, because everyone has played a role. Every chapter president, everyone working for Cure SMA, everyone working for Biogen, everyone working for all these other companies that have raised awareness, that have fought hard to make change and advocate for their kids, for themselves, for everyone in this community. It's all due to you, and it's an overwhelming feeling right now. So back to your question. I am just so excited for any small gain that Madison's going to receive. She will be able to finish a meal, and that's a big deal. While she has a feeding tube, she really enjoys eating, and she can't do that fully. Itch the top of her head. All these little things that make a difference for them, they're huge. The little gains that she's going to receive are going to be life-changing in some small way and big ways. So it's all worth it for us to do this. And thank you again for everyone.
Oh, well, congratulations. I have a follow-up question for you, so don't run away with the mic quite yet. So what is the improvement that will allow her to be able to finish a meal? Is it swallowing?
She fatigues during eating. She'll get really, really excited. I'm starving, and I really want this meal, whether it's even mashed potatoes or her favorite thing is buffalo chicken wings. She gets really excited. I'm starving. Don't give me just 4 wings. I want 10. I'm going to finish these. And she'll eat 2. And she just fatigues, and she just can't eat anymore. Even though she's dying to, she just is too tired. So yeah, that's one of the things. And, her stomach has shrunk because of all that as well. And in the same aspect, her body doesn't move the bowel system. So when the bowel system is backed up, they can't eat as much either. So it affects, both ends, and she just doesn't feel as good, even though she has that urge to really want to eat and fully enjoy a meal. Yeah, thank you.
Thank you for sharing. All right, we'll move to the middle of the room.
Hi, my name is Allison Henkel. I live outside of Philadelphia with my husband and 4 kids, one of whom has type 2 SMA. Pete, he's 12, almost 13, 7th grade, happy, like most of our kids. Recently, Pete has declined. He's a weak type 2, and he's same as what Paula said. As he's gone through puberty, he got hit really hard. He lost the ability to feed himself about 2 years ago. But just this year, his speech started to become affected by SMA, and we just never expected that. He's had 3 doses of the loading dose of Spinraza at CHOP. So we're fortunate that our insurance companies approved it quickly and CHOP got on board. So we're hoping, because Pete has had a lot of independence. He's been able to drive his wheelchair. He walks through Wayne with the middle school kids, tortures the shop owners, just like a middle schooler should do. We're really hoping he doesn't lose that independence to drive his wheelchair, because he's struggling with that too as he loses his left hand. And really hope that he doesn't lose the ability to communicate, because that would be a big game changer in his life. So we're hopeful that he can keep his speech and improve as he continues to receive the Spinraza. So thank you for all you're doing.
Great. Thank you for sharing. We have a comment right here. And then we'll go.
I'm Angel. My daughter Madison is 14. And I just kind of want to piggyback on those comments, as some of us have older teenagers who have been stronger and been able to do things on their own, and are now getting older and their bodies are continuing to grow, but they get weaker. I think it's a challenge because they're in that kind of difficult age in life already, where they're in middle school, or my daughter's getting ready to go to high school. And while she's very excited about that, we start to see some of those things too, where she has gotten weaker over the last year. She's lost a lot of head control, the ability to feed herself. And so I think for myself and some other families who have similar age children, that for us, it's even not losing any more ability, even if we don't gain anything, for them not to lose anything more than they already have.
Sure. Thank you. And then we have another comment over here.
I'm Heather. I have type 2 SMA, and I'm 28 years old. So by now I have a pretty settled life. I work. I'm getting my master's part-time. I have a social life. I'm not excited to interrupt that majorly. But on the other hand, I'm 28. I'm getting older. Even though I'm not progressing rapidly, it's the small changes that you don't notice that add up over the years, and you don't see until you look back 10 years what you've lost. So as much as I don't want to disrupt the life I have, I don't want to lose more strength, because losing more would disrupt my life just as much as any treatment would. So I think for me it's about, I think a lot of it is the administration of the treatment, because if it requires surgery or anesthesia, that's pretty risky medically for me. It's very difficult to intubate me. Going through a major surgery is not a small thing. But if it were an outpatient thing, treatment that I had to go to a few times a week, once a week, I'd be more willing to disrupt it for that if it meant I'm not losing more strength down the road.
Sure. Thank you. Yeah, so one of the comments that we've heard before is that for individuals that have had spinal fusion, administration of intrathecal drugs can be difficult. So I was wondering if that's what you're referring to, and if there's others that, so I'm getting a nod of the head, yes. Do you want to say anything to that?
So I'm from Pittsburgh, and I have contacted a few physicians in the area, both pediatric and adult, and no one I've talked to is willing or interested or really looking into administration of it, because I have a spinal fusion. So it's difficult. I honestly don't even know if it would be a challenge medically, because I'm the one that's having to do the research and searching for other patients' experiences, and it's hard when the physicians I am trying to get information from aren't knowledgeable and don't seem very motivated to investigate and research more.
Sure. Does anyone else have experience with that you'd like to add on, or? I don't know. So we're,
I just want to say yes. I think that there's a large population of the SMA community that is very interested in pursuing the Spinraza or any other treatments as they come up that have a fusion, a spinal fusion. And at this point, there hasn't been the official trials or anything to further that, but there is a large population of affected patients with SMA that are very interested in that and would like to see that furthered.
Sure. Did you want to add to that? Yeah. Or...
Well, mine was kind of before those two.
Oh, yeah, that's
big
okay.
comments.
Yeah.
Well, I was just going to add on to that. So for people with SMA type 3, it seems like the plateau phase is, it's a slow and steady decline, but we seem to lose in milestones. And so with a couple of years, so say for 5 years, you are using 80% of your muscle strength to do one task. And then the next 5 years, you're using 90% and so on. Once we reach that threshold where we are using all of our muscle and we can no longer perform that task, we are no longer able to do any of that. And that could be walking, lifting an arm. So that's probably, for me, when I would search out for treatment, it would probably depend on the number of milestones I'm no longer able to do. So it's not, while the rate of decline is steady, we kind of lose in chunks, if that makes sense.
So where you're at currently, what would be that next milestone where you would want to seek something out?
A threat to my independence. I'm very independent as of right now. So if I have any threat to that, if the next milestone I have, I'm no longer able to, drive myself somewhere, I think I would probably seek out treatment.
Okay, great. Thank you. And then we have a comment here in the middle. Oh, you've already got a mic, so we can go right there and then come right here. Yep, and then we'll come to you.
I was just going to say,
TJ's
type 1, but he got his back fused this summer, and I don't know if it's going to become standard practice, but they left a spot so that he could get spinal injections, knowing that this was coming down the pipeline. Because when he came out of surgery, the surgeon said, just so you know, if you decide to have injections in the spine in the future, we left a space. So I don't know if that's going to become practice or not.
Sure. All right. So we've got a comment right here, and then we're going to come up to the front for Hugo.
Hi, Rosie McClay again. My daughter's 14, so she has a full fusion. And just reiterating again, definitely the interest. At this point, we're fully approved by our insurance. Our hospital is dosing. We've had labs drawn. We've had a CT scan, and then found out there's no opening. So we're back to waiting. But I think to be mindful around those emotions. I actually had our doctor, who I love, say, "Mom, you seem anxious." Really? I seem anxious? I've fought for this for 13 years and waiting for a chance. So we're definitely out here, and we're definitely waiting for some sort of solution to that problem.
Great. All right. And we'll come up to Hugo.
Well, one thing that I wanted to add too, as an adult with SMA, especially type 3, I think that as a child, like when there was no treatments out there, and just constantly going to doctors and or even being religious at one point too, you're constantly praying that you hope that there is a cure out there. It led for me to become very sad and to become very depressed because, I didn't understand why there weren't treatments, why God's not finding a cure or something. And so I think it became finally that stage too where I finally just accepted my disability, stopped wanting to find the cure or and just fully accepting that this is going to be my life. I'm going to be in a wheelchair. This is what I can do. What can I do with my disability? And so I don't know. And even with the media too, of how they're constantly portraying us that people with disabilities are constantly looking for that cure, wanting that magic pill, wanting I don't know, just that a fairy godmother comes out and makes us walk for a day or something, and we get to experience these things. And that would like kind of annoy me too, because I'm like, well, I don't know, like I'm living my life to the fullest. I do all these things, like that's not me, right? And so finally this treatment comes out, Spinraza, and just freaking does a 360 on everything that I've been thinking, saying, advocating for myself. And so it took a lot for me as an adult to come to terms with like, oh my God, like I didn't think I was gonna see this treatment in my lifetime, and now here it is. And so the drug came out, and like I had some of my friends that are adults with SMA not wanting the treatment at all, and then some of my friends with SMA wanting the treatment. And so I was reading all these Facebook posts of like some people very, very happy, some people kind of commenting that like, oh, it's not for me. Meanwhile, I was like kind of like staying quiet, not posting anything about it, whether I was happy or sad about it. I mean, definitely when patients would come to me, like I do everything to help them find a doctor that could help them get the treatment, they could talk to a specialist. And so finally, after about 3 months of the drug being out there, I decided, you know what, I need to undergo, I need to accept it, and maybe it's something that will be for me. Only to make my appointment, put on a waiting list for my doctor to see me, even though it's my regular neurologist. To finally finding out that she could see me. All of a sudden, I get a call she could see me the next week. So I go in there only to find out that my doctor has not prescribed it to any adults with SMA. That she doesn't really know much about the drug, doesn't really know if the side effects are going to harm me or if they're actually going to improve me because I'm 27 years of age. I don't know. And so it was very hard for me because at first I was like, I'm not doing this. And then finally when I did the switch in my mind of like, I definitely want to be a part of this, and to like taking time out of like also like my schoolwork, or like I'm also going to grad school. I had to take time off from work as well to go to my appointment. And so, I don't know, the transportation's not easy when you're in a wheelchair. And so just all these things of like going there, sitting with my doctor and getting this rejection was, something that like definitely like even that depressed me too. And I wasn't like expecting, or in my mind too, I was like, I just kind of want to get the conversation started. And so I don't know, it's hard. And so I'm excited to be able to see that hopefully maybe some clinical trials to be done in adults. And it's something that I've never participated in a clinical trial ever in my life. But I think that if that was the case, I would jump on it like immediately. And I do want to move it along for like those patients that are adults that do want it. And to also for those patients that maybe are on the fence about it or feel like it's not for them and they've accepted a disability, because I've definitely accepted my disability, but I think it's wonderful that we now have this new thing to look forward to, that we never had something to look forward to before.
Yeah. So it sounds like it might be useful to have more information in adults
exactly.
to help you make your decision.
Yeah, and so I would definitely love to know like what are the side effects, or be a part of that trial and see like if it will help me, because I think that it should be an option for adults as well. Mm-hmm. I'm super happy for all the children as well, but I want to see something also for the adults. I mean, like I said in my speech, I don't expect to walk, but even the small changes of like, being able to maybe dress myself or just do a transfer in and out of bed or from into the toilet, like that would be huge, not having to rely on someone 24, like, or 100% of the time, I mean.
Sure.
Thank you.
I think we have a question or a comment right here.
Just a comment, yeah. I kind of on the same line of thinking that Hugo is, whereas if there was something that I knew that I could participate in, I would definitely be interested in learning more about it. But I think that it's the undereducation of a lot of the neurologists for adult patients that leads to the difficulty with achieving that. Mm-hmm. I stopped seeing my diagnosis. I was diagnosed at CHOP in Philadelphia. Then I saw the same neurologist until he no longer worked at CHOP, and I was moved to Dr. Richard Finkel, and I saw him until relatively recently, as in the last 7 years. So it's been quite a number of years since I've actually seen a neurologist at all. Now that I'm an adult patient and Richard Finkel doesn't work at CHOP anymore, I don't have that option of going back to a pediatric hospital for neurology or to see SMA. So I'm left with living in New Jersey and having very limited options as far as being an adult patient with SMA and finding a neurologist and a team of doctors that can look at me with an education and understand what my disease does, and what studies and clinical trials there are out there for me to participate in. I don't personally have a primary care doctor that knows very much about my condition either, and I'm usually left stuck educating most doctors and hospital staff about what I have and what it means, and when I have to go to the hospital, and when I see my primary care doctor. I'm usually the one that's more up to date on the clinical trials, but there are a number of them, and not having access to that because of the limitations in my place where I live, and then being further compounded by not having insurance that whether or not a neurologist that I could see that might be somewhat local will accept my insurance or not, that's a further complication. So right now, I have a tentative appointment later in May to see a new neurologist in New Jersey. It's kind of I guess a risky situation because I don't know if they're going to know what I have if they dealt with it before, but it doesn't seem like it's going to be a terrible situation, so I'm willing to try it. I'm hoping that I experience something better, but I am concerned about my spinal fusion and how that's going to play into whether or not Spinraza is going to be an option for me. I'm not necessarily disinterested in it. I am an adult. I do work. I do many things that I have a routine now, and to disrupt that, I'm willing if I'm able, but I'm not sure that I'm going to be able, and taking a lot of risks to go and disrupting my normal life is a big deal. And from what I've noticed with my progression over my entire lifetime, is that when I have an established routine is generally when I meet a plateau. And then once I disrupt that routine and I disrupt my ability to exercise and engage in physical therapy and other things, that's when even nutritional, being able to eat and drink regularly to keep my body healthy, that's when I meet fierce progression. So, that's what my concerns are.
Oh, thank you for sharing that. So we can take one more comment, and then we're going to have to move to the clinical trial polling questions before we wrap up today. So,
again, my name is Tom, and my daughters are Jessica and Heather. And between Jessica and Heather, I guess they're sort of a study in contrast as to what, as a caregiver, I would look for really for each of them. Heather, as she mentioned, she's been getting a little weaker lately over the past few years. So when I look at Jessie, on the other hand, I'm thinking a treatment for her to just keep her out of the hospital, keep her from getting a pneumonia, keep her from having to deal with really a catastrophic pulmonary event, is what I'm looking at with her. With Heather, on the other hand, the last few years have become more difficult. I mean, people talk about maybe brushing their hair. We're to the point of even her being able to help her brush her hair better. Just the little things, that positioning, the difficulties in doing the daily caregiving are becoming harder. And so our expectations lower, I guess. You go from hoping they'll walk to hoping that they'll stay out of the hospital to hoping that life will become just a little easier.
No. Thank you. So this has been really, really valuable input on what you're looking for in future treatments. Clinical trials did come up in a couple of comments, so we have just enough time to actually go through these polling questions. So I'll ask if we can pull up the questions for the clinical trial polling. All right, so for our participants representing individuals with type 2 and 3 SMA, if you can respond to these polling questions. The first is, have you or your loved one ever participated in any type of clinical trial studying experimental treatments for SMA? Please select all that apply. I'll give you a few more seconds getting your responses to this. All right. So it looks like the majority of you have tried to, or not the majority of you, but the greatest response that we have is that you've tried to enroll in a clinical trial, but did not qualify. The next highest number of you have not participated in a clinical trial. A number of you have, and others of you have tried to enroll, but it was closed. A few of you did not want to enroll due to the burden of the trial, and others did not want to enroll for other reasons. And it looks like maybe only one or two of you received access through an expanded access program. Can we have our next polling question? So this polling question is, which of the following factors would you rank as most important to your decision about whether to participate in a clinical trial to study an experimental treatment? And you can select up to 4 for this. Just a few more seconds to get your responses in. So it looks like the consistently highest factor is that whether or how the treatment might prevent further disease progression or improved you or your loved one's health. The next most responded factor is the risk of a rare but serious side effect, such as a life-threatening allergic reaction. We have quite a range of other responses, some of the other more highly responded being the reputation of the study site PI, the promise of receiving open label therapy at the end of the study, and the availability of safety data. And can we get to our final question on insurance access? So this question is, what type of insurance do you or your loved one have? Please select all that apply. So it looks like a little over half of you have private or commercial health insurance, a little over a third have Medicaid, and about 10% have Medicare. It seems like a fairly similar to what we heard from the type 1 SMA caregivers. So that concludes our polling, and that concludes our discussion of topic 2. I want to thank you all for sharing your very important voice with me throughout this day. It has really been my honor to have the opportunity to be a part of this meeting and work with Cure SMA on this project. I know that FDA has been here and listening, and you'll get to hear momentarily from someone from the FDA. I do want to remind you that although you probably have other input that you want to give, or if you're still tuned in with us on the webcast, you may have some answers to these questions that we discussed in the room. So I do want to remind you that you will receive a link through the registration that will give you a form to be able to provide your written responses within the next 30 days. And also, I want you all to know that FDA, industry, and academia will get to benefit from your input beyond what was just kind of absorbed by them today. Know that the recording from today will be posted online for their reference, and that Cure SMA is going to work diligently to put together a Voice of the Patient report, which is the official summary of the meeting that will be formally submitted to FDA.